Welcome to the deep dive. This is where we take those really critical, sometimes, overwhelming topics, and we try to break them down into clear, confident, actionable knowledge for you.
Yeah, and today, we're tackling something incredibly important. It might just be one of the most vital deep dives we could do, putting together a kind of mental emergency action plan for when you suspect a heart attack.
Exactly. And our goal here isn't to scare anyone.
No, not at all. It's really about empowerment. We want you to walk away from this feeling calm, feeling prepared, absolutely ready to act if you or maybe someone near you has what looks like a cardiac event.
We've gone through the latest guidelines, the evidence-based stuff from the big names, right?
That's right. We're talking American Heart Association, the Red Cross, Mayo Clinic, really gold standard sources. We've synthesized their protocols for this.
And we're laser focused on that immediate response, those first critical minutes. Because the stakes are just incredibly high.
They really are. Think about this. In the U.S., a heart attack happens about every 40 seconds.
Wow, every 40 seconds.
Yeah. And that urgency we feel when we talk about it, it's completely justified. The stats are stark. Most people who die from a heart attack, they actually succumb within the first couple of hours after symptoms start.
2 hours. That's not a lot of time.
It's really not. It tells us loud and clear that the initial response, that window between the very first sign and getting professional medical help, well, that often makes all the difference. Life or death difference.
Time is literally heart muscle, as they say.
Precisely. The speed of your decisions, your actions, that's probably the single biggest factor in survival and, importantly, recovery afterwards.
Okay. Let's dive in then. Let's build this essential emergency blueprint together.
Right. So to even start building that blueprint, we first need to understand what we're dealing with, the heart attack itself.
Okay.
Medically, you'll hear it called a myocardial infarction, or MI. Basically, it happens when the blood flow to a part of your heart muscle gets seriously cut back or completely blocked off.
And what's causing that block, usually?
Overwhelmingly, it's a blood clot. What happens is plaque, that fatty stuff, builds up in the coronary arteries over years. If a piece of that plaque breaks open, a clot forms really fast right there, and it just chokes off the blood supply downstream.
And without that blood, the heart muscle doesn't get oxygen.
Exactly. No oxygen, no nutrients. So the tissue starts getting damaged, and if it goes on too long, it dies. And that damage, that's permanent.
Okay, so when we think symptoms, the classic movie scene comes to mind, someone grabbing their chest, collapsing.
Right, and that definitely happens. That's real. But it's really, really important to know that's far from the only way it presents. Let's start with those classic signs, though, because they are still the most common, particularly for men.
What are they?
That classic picture involves uncomfortable pressure, maybe a squeezing feeling, fullness, or actual pain, usually right in the center of the chest. People often describe it like, an elephant sitting on their chest.
Heavy.
Very heavy. And a key thing here is that this feeling lasts more than just a few minutes. Or sometimes it might seem to go away, but then it comes roaring back. That pattern is a big red flag.
And crucially, that discomfort, that pain, it doesn't always just stay in the chest, does it?
No, absolutely not. That's another critical thing to watch for discomfort that radiates or spreads. We're talking pain or tightness that moves, maybe into one or both arms, sometimes the back, the neck, the jaw, even the teeth occasionally. Or sometimes it feels like it's in the upper part of the belly, the stomach area.
Why does it spread like that?
It's basically following nerve pathways. The heart's distress signals get referred along those shared nerve routes. Another major sign, and this can happen with or without any chest discomfort at all, is shortness of breath, feeling like you just can't get enough air.
Okay, now this next part feels really vital for everyone listening, because it's not always that dramatic Hollywood scene. We need to talk about the subtle signs and maybe the psychological hurdle of denial.
Yes, denial is a huge factor. Our sources really hammer this point home. Many heart attack symptoms are actually quite subtle. They can easily be mistaken for something way less serious, maybe acid reflux, indigestion, maybe you think you're just tired or coming down with the flu or just feeling your age.
It's human nature to explain things away, isn't it?
It absolutely is. We look for the easy, non-scary explanation, but the medical advice is crystal clear. You cannot afford to ignore these subtle feelings. Never just brush them off. There are several key warning signs that often get missed.
Okay, let's get specific. What are those indicators that might seem small but should set off alarm bells?
Okay, so things like breaking out in a sudden cold sweat when you haven't been exerting yourself, unexplained nausea, maybe even vomiting, suddenly feeling really lightheaded or dizzy, or experiencing extreme fatigue, like a level of tiredness that feels completely out of proportion to what you've been doing recently.
That sounds easy to dismiss as just being run down.
It is. And another one, which sounds a bit strange but is reported quite often, is this profound sense of anxiety or like a feeling of impending doom. Just knowing something is terribly wrong. If you feel that, listen to it. It's your body screaming for attention.
Wow. Okay, and you mentioned earlier that symptoms can differ, especially between men and women. This feels really important because historically, women's heart attacks were often missed.
Yes, that's a critical distinction. While chest pain or pressure is still the most common symptom overall, even for women, their signs might be milder. Or they might be accompanied by more of these general, vague symptoms we just talked about.
So not necessarily the crushing chest pain.
Not always. Or maybe it's there, but it's not the main thing they notice. For women, sometimes the pressure is felt more in the upper back. We hear descriptions like a squeezing feeling back there, or almost like a rope is being tied tightly around their upper body.
A rope. That's a vivid description. Where else might the pain show up more often in women?
Pain in the shoulder is common, or the jaw, or sometimes that upper belly pain again. But perhaps the biggest difference reported is that overwhelming, unusual tiredness and weakness, that really debilitating fatigue we mentioned. It seems to be much more common in women, sometimes for days or weeks before the actual event, or right alongside it.
That's really crucial information. And it's not just women, right? You mentioned other groups might have less typical symptoms.
That's right. People with certain underlying conditions, especially diabetes, can have nerve damage, neuropathy, that actually dampens the pain signals. So their heart attack symptoms might also be quite vague or subtle. It really underscores the need to listen to your body, even if it doesn't fit the textbook picture.
It forces you to trust your gut feeling, even if the symptom isn't, the classic one. Okay, speaking of confusion, we have to address the overlap between heart attack and panic attack symptoms. They can feel terrifyingly similar.
They absolutely can. Chest pain, lightheadedness, nausea, shortness of breath, intense fear. You can get all of that with both. It's because both conditions can trigger the body's fight or flight response, the sympathetic nervous system.
So how can you possibly tell the difference in the moment?
Well, there are some general patterns, though it's tricky. A panic attack often hits very suddenly, like a thunderbolt. It usually peaks in intensity within about 10 minutes or so, and it's often linked to a feeling of intense fear or anxiety driving it.
Okay, sudden onset, quick peak, and a heart attack.
A heart attack often starts more slowly. The symptoms tend to build up more gradually, maybe over minutes or sometimes even hours or days leading up to the main event. It's often more of a progression. But honestly, that distinction is kind of academic when you're in the middle of it.
Right. So if you're there or someone you're with is there and you're thinking, is this anxiety? Is it my heart? What's the absolute bottom line advice from all the medical sources?
The absolute non-negotiable rule is this. When in doubt, always assume it could be a heart attack and get emergency help immediately. Call 911, full stop.
Don't hesitate.
Yeah.
Don't try to self-diagnose.
Exactly. Like Dr. Glenn Levine from the AHA emphasizes, it is far, far better to have a false alarm to go to the ER and find out it was just indigestion or anxiety than it is to wait too long and suffer irreversible heart damage or worse. Err on the side of caution. Every single time. Don't try to rationalize the symptoms away.
Okay, so recognition happens. You've acknowledged the signs, subtle or classic. Now we shift instantly to action. This needs to be automatic almost.
Yes, seamless transition. These next steps are what bridge that dangerous gap between the first symptom and getting professional medical care.
And again, the watchwords here are speed and calm, right? What is the single most important, foundational, number one rule?
The absolute number one rule, the thing you do before anything else, is call 911 or whatever your local emergency number is immediately. Immediately. This is totally non-negotiable. Don't waste time calling a friend first. Don't Google clinic hours. Don't even pause to grab your keys thinking you'll drive. You must activate the emergency medical system. Every second you delay is potentially more heart tissue being lost.
Okay, let's talk about that driving yourself idea. Because I imagine in a panic or think you can get there faster, some people might just jump in the car. Why is calling EMS so much better?
That is one of the biggest, most dangerous mistakes people make. Never drive yourself, and don't let the person having symptoms drive themselves. There are two huge risks here.
Where are they?
First, what if the person suddenly develops a serious heart rhythm problem, an arrhythmia, or even loses consciousness while driving? Now you've potentially caused a major car accident, injuring yourself and possibly others. It's incredibly dangerous.
Right. And the second reason?
The second reason is that the paramedics start life-saving treatment the second they arrive at your side. They can give oxygen, they have monitors, they have medications, they can communicate with the hospital. You simply cannot get that level of care in your own car. They can also often take you directly to a specialized cardiac center, potentially bypassing a crowded ER waiting room.
So the ambulance isn't just transport, it's a mobile treatment unit.
Exactly. Driving yourself should only be considered if there is absolutely positively no other way to get help, like you're completely isolated, no phone service, that kind of extreme situation.
Huh.
Otherwise, call 911.
Okay, 911 is called. Help is on the way. Now we're in that waiting period. What do we do right then and there to help the person and ease the strain on their heart?
Your main goal now is rest. Minimize the heart's workload. So have the person stop whatever they were doing immediately. Sit down.
What's the best position? Lying down, sitting up.
The best position is usually seated upright with their back supported if possible, maybe leaning against a wall or in a sturdy chair. Lying flat can sometimes increase the amount of blood returning to the heart, which might actually make chest pressure or shortness of breath feel worse. Sitting upright tends to be more comfortable and slightly reduces the heart's workload.
Okay, seated upright, supported. What about managing the scene, the person's mental state?
Yes, this is important too. If you're the bystander, try your absolute best to stay calm yourself. Your calmness can help the person experiencing symptoms stay calmer. Remember, stress and panic release hormones like adrenaline, which makes the heart beat faster and work harder, exactly what we don't want right now.
So keep the environment calm. Anything else physically?
Yeah, loosen any tight clothing. A tight collar, a belt, a tie, anything that might be restrictive or uncomfortable. Just help them be as comfortable as possible. And offer reassurance. Let them know help has been called, that it's on the way, that they did the right thing by getting help.
Okay. Now, let's touch on some other mistakes the sources warn about. Things people might do in panic that actually waste precious time or make things worse.
Well, we already covered the big one, ignoring symptoms, even mild ones. But another danger is trying unproven home remedies you might find online. The sources specifically mention things like trying forceful, repeated coughing, sometimes called cough CPR, or drinking hot water or special concoctions.
Do those things work?
No, they're completely useless for fixing a locked coronary artery. All they do is waste critical minutes when you should have been calling 911 and waiting for real medical help. Don't try folk remedies.
Good to know. What about giving them something to eat or drink? Maybe a glass of water to calm them down?
No, definitely avoid giving them anything to eat or drink. There's a real risk that their level of consciousness could suddenly decrease during a severe heart attack. If that happens, and they have food or liquid in their mouth or throat, they could easily choke or aspirate it into their lungs. That makes rescue efforts much, much harder for the paramedics. The only things they should potentially take by mouth are aspirin or their own prescribed nitroglycerin, and only after 911 is called.
Got it. So the immediate steps are clear? Recognize. Call 911 immediately. Stop activity. Sit upright comfortably. Loosen clothing. Stay calm. Avoid food, drink. Okay, that brings us logically to the first potential medication we can offer.
Right. So emergency services are on their way. The person is conscious, they can understand you, and they're able to choose safely. The next potential step is giving aspirin.
Aspirin. It's in pretty much everyone's medicine cabinet, right?
Yeah.
Usually for headaches or minor pains. How does this everyday drug become so critical during a heart attack?
It's all about how it works on the blood. Aspirin is a potent antiplatelet drug. Remember that blood clot causing the heart attack? Think of it like a growing traffic jam in the artery. Platelets are the tiny blood cells that rush to the scene of plaque rupture and start sticking together, forming that clot, that barrier.
Okay.
Aspirin interferes with the chemical signals that tell those platelets to clump together and stick. It makes them less sticky.
So it doesn't actually bust up the clot that's already there.
Not really, no. Its main job in this acute situation is to help prevent the clot from getting bigger. It stops more platelets from joining the pileup. This helps keep whatever little blood flow might still be trickling past the blockage going, giving the heart muscle a better chance until doctors can intervene definitively at the hospital, maybe with clot busters or a procedure.
That makes sense. And this is why how you give the aspirin is so important. It's not just swallowing a pill like you would for a headache, is it?
No, and this is absolutely critical information to remember. The aspirin must be chewed or crushed before swallowing.
Why chewed?
Because if you just swallow it whole, it has to go down into your stomach, then into the small intestine before it really gets absorbed into your bloodstream. That takes time. Chewing it starts the absorption process much faster, right through the lining of your mouth and esophagus. It gets into the bloodstream quicker, where it can start working on those platelets faster. In an emergency like this, minutes count, and chewing shaves off vital absorption time.
Okay, chewed, not swallowed whole. What's the right dose?
The standard recommendation for a suspected heart attack is to help the person take 2 to 4 low-dose aspirin tablets. Those are usually 81 milligrams each, for a total dose of 162 to 324 milligrams. Or if you have regular strength aspirin, which is usually 325 milligrams, just one of those tablets is the right amount.
2 to 4 baby aspirin, or one regular one, chewed. Got it.
Right. Make sure they chew it thoroughly.
Now, this is where it gets a bit tricky, right? Contraindications. Aspirin isn't safe for everyone, especially concerning bleeding risks. How do you weigh that in an emergency?
This definitely requires a moment of calm assessment. First things first, check the aspirin type. You absolutely want to avoid anything that says enteric-coated or safety-coated.
Why avoid those?
Because that coating is specifically designed to delay the aspirin's release until it gets past the stomach to protect the stomach lining. That delayed action is exactly what you don't want in an emergency. You need rapid absorption. So plain, chewable aspirin is best.
Okay, no enteric coating. What about the person's medical history?
If the person is conscious and able to communicate, you need to quickly ask 2 key things. First, are you allergic to aspirin? If they say yes or have a known severe sensitivity, then obviously no aspirin. Stop right there.
Okay, allergy check first. What's second?
Second, ask about bleeding risks. Do you have any bleeding disorders? Or have you recently had any serious bleeding, like from an ulcer? Or are you taking any strong blood thinners? If they have a condition that makes them bleed easily, or a recent history of significant GI bleeding, or if they're on potent anticoagulants like warfarin, then giving aspirin could potentially cause dangerous bleeding.
That puts a bystander in a tough spot, potentially having to make a judgment call fast.
It does, but the general guidance is that for someone having active chest pain that strongly suggests a heart attack, the immediate benefit of aspirin in preventing further clotting usually outweighs the potential risk of bleeding, unless there's a clear known major contraindication like a severe allergy or very recent major bleed.
So lean towards giving it unless there's a strong reason not to.
Pretty much. But if you have any doubt, or if the person mentions a significant bleeding history or is on strong blood thinners, the safest bet is always to rely on the 911 dispatcher. Tell them the situation, tell them the person's history if you know it, and follow their guidance while you wait for the paramedics. They are trained for these exact scenarios.
That's good advice. Rely on the professionals on the line. One last medication point. What if the person has their own prescription for nitroglycerin?
Ah, right. Nitroglycerin works differently than aspirin. It's a vasodilator, meaning it helps to relax and widen blood vessels. This can sometimes improve blood flow temporarily and often helps ease chest pain by reducing the heart's workload.
So if they have it prescribed...
Yes, if they have a current prescription for it, it absolutely must be their own prescription. You can't give them someone else's. Then you can definitely assist them in taking it as prescribed while you're waiting for EMS. Usually it's a small tablet or a spray that goes under the tongue. But again, this is something you do after calling 911, not instead of it. Aspirin and potentially their own nitro are supportive measures while waiting for definitive care.
Okay, we've covered recognizing the signs, the immediate first aid steps, and the potential role of aspirin. But we need to be prepared for the situation to get worse. A heart attack, which is fundamentally a plumbing issue, can sometimes lead to something even more immediately life-threatening: cardiac arrest.
Yes, and understanding the difference here is probably one of the most crucial distinctions for anyone listening. It helps clarify what action is needed when. Think of it like the heart's plumbing versus its electrical system.
Okay, explain that analogy. Plumbing versus electrical.
A heart attack is a plumbing problem. Like we said, there's a blockage in an artery, the pipes, the plumbing cutting off blood flow to a part of the heart muscle. During a heart attack, the person is usually still conscious, still awake, though likely in significant pain or discomfort.
Got it. Plumbing problem, heart attack. Person often awake. What about cardiac arrest?
Cardiac arrest is an electrical problem. The heart's internal electrical system, which tells it when to beat, goes haywire. It either stops completely or it starts beating so chaotically and ineffectively that it can't actually pump blood out to the body and brain.
So the heart isn't pumping blood at all?
Essentially, no, or not effectively enough to sustain life. And the signs of cardiac arrest are very clear and very sudden. The person collapses, they lose responsiveness completely, and they stop breathing normally. They might not be breathing at all, or they might just be taking occasional ineffective gasps, sometimes called agonal breathing. It's not normal breathing.
That heart attack can cause a cardiac arrest, right?
Absolutely. The damage from the heart attack, the lack of oxygen, can trigger that fatal electrical malfunction. So they are linked, but they are different events requiring different immediate actions.
Okay, so if the person we're helping suddenly becomes unresponsive, stops breathing normally, we've shifted gears, it's no longer about sitting them up or giving aspirin.
Exactly. Now the priority shifts entirely. It's about keeping oxygenated blood flowing to the brain until help arrives or the heart can be restarted. This is an immediate life or death emergency.
What are the absolute first steps if someone collapses like that?
Okay, first, quickly check if the scene is safe for you to approach. Then, check for responsiveness. Tap them firmly on the shoulder. Shout, "Are you okay? Are you okay?" If there's no response, shout for help immediately. Tell someone specific, "You, call 911 right now." Or call yourself if you're alone. And crucially, tell someone to find and bring an automated external defibrillator, an AED, if one is available nearby. Many public places have them now.
Okay, 911 called, AED requested. Now what? CPR. People get really nervous about CPR.
They do, and that's understandable. People worry about doing it wrong or hurting the person. But the medical community has really simplified the instructions to encourage bystanders to act, because some CPR is infinitely better than no CPR.
So what's the advice for someone who hasn't had formal training?
If you are untrained, the recommendation is hands-only CPR. It's exactly what it sounds like. You put the heel of one hand on the center of the person's chest, put your other hand on top, lock your fingers, keep your arms straight, and push hard and fast.
Yeah, hard? How fast?
You want to push down about 2 inches, hard enough to compress the chest, and do it at a rate of 100 to 120 compressions per minute. A good way to keep rhythm is to think of the beat of the song Staying Alive. Push hard, push fast in the center of the chest, and let the chest come all the way back up between pushes. That constant compression is manually pumping the blood.
Just keep doing that.
Just keep doing that. Focus on consistent, deep compressions. That alone provides vital blood flow to the brain until the paramedics arrive.
And if someone has been trained in CPR?
If you are trained and feel comfortable doing so, the standard protocol is still 30 chest compressions, followed by giving 2 rescue breaths. You tilt the head back, lift the chin, pinch the nose shut, make a seal over their mouth with yours, and give 2 breaths, just enough to make the chest rise. Then immediately back to 30 compressions. But again, if you're hesitant about breaths for any reason, just stick with the hands-only compressions. That's the most critical part.
Okay, compressions are key. What about the AED? If someone brings it, what do we do? People might be intimidated by it.
Don't be intimidated. AEDs are designed to be used by anyone, even without prior training. As soon as it arrives, turn it on. Just open the lid or press the power button.
And that.
It will talk to you, literally. It will give you clear step-by-step voice instructions. It will tell you where to place the sticky pads on the person's bare chest. There are usually pictures on the pads themselves. Then it will tell everyone to stand clear while it analyzes the heart's rhythm.
Can it make a mistake? Can it shock someone who doesn't need it?
No, that's the beauty of it. The AED is smart. It will only advise delivering an electrical shock if it detects one of those specific chaotic heart rhythms that a shock can potentially fix, like ventricular fibrillation. If the person's heart has stopped completely or if it's beating normally, the AED will recognize that and will not allow a shock. It will likely tell you to continue CPR instead. You just follow its voice prompts exactly.
Okay, turn it on, follow the voice prompts. Seems straightforward.
It really is. If it advises a shock, it will tell you to make sure no one is touching the person, and then usually tell you to press a flashing button to deliver the shock. After the shock, or if no shock is needed, it will typically tell you to resume CPR immediately.
So once we start CPR or use the AED, when do we stop?
You keep going. You continue performing CPR, following the AED's prompts if it's attached, until one of 3 things happens. Emergency medical services arrive and tell you they're taking over. The person shows obvious signs of life, like starting to move or breathe normally on their own, or the situation becomes unsafe for you to continue. Otherwise, you keep those compressions going. Your sustained effort is their best chance.
This leads perfectly into something that often holds people back from helping, especially with things like CPR or using an AED, the fear of getting sued if something goes wrong. We need to talk about Good Samaritan laws.
Yes, absolutely. It's a really important piece of context because that fear of liability is a genuine barrier for many potential rescuers. Even off-duty medical professionals sometimes hesitate. Understanding these laws can provide crucial reassurance.
So what's the basic idea behind Good Samaritan laws? Where do they come from?
Well, the name comes from the biblical parable, obviously, about helping someone in distress. The legal principle is pretty much the same. These laws are designed to encourage people to voluntarily step up and help others in an emergency without expecting payment by offering them some legal protection.
Protection from what exactly?
The core protection, which exists in some form in all 50 U.S. states and Washington, D.C., is shielding the rescuer from liability for what's called ordinary negligence.
Okay, what does ordinary negligence mean in this context?
It basically means failing to act as a reasonably careful or prudent person would have acted under similar emergency circumstances. For example, if you're performing CPR as best you can, following the general guidelines, but maybe you inadvertently break one of the person's ribs, which, by the way, is actually quite common and often unavoidable with effective compressions. Good Samaritan laws generally protect you from being sued for that injury.
So you don't have to be perfect, just reasonable for a bystander in a crisis.
Exactly. You acted reasonably, in good faith, trying to save a life. The injury was an unfortunate, perhaps unavoidable consequence of a necessary life-saving action. The law recognizes that and aims to shield you from lawsuits based on those kinds of outcomes. The whole point is to reduce the fear that simply trying to help could lead to legal trouble for you.
But I assume there are limits. It's not a free pass to do anything, right?
No, definitely not. The protection generally stops when conduct crosses the line into gross negligence or willful or wanton misconduct.
What's the difference? What counts as gross negligence?
Gross negligence is a much higher degree of carelessness. It implies a conscious, voluntary disregard for the need to use reasonable care, demonstrating indifference to the consequences. So, for instance, if you, as an untrained person, decided to attempt some bizarre, reckless procedure way beyond your skill level, like trying to perform surgery with a pocket knife, that would likely be considered gross negligence. Or if you acted with intent to cause harm. The laws protect good faith efforts, not reckless or malicious actions.
Makes sense. What about getting permission? If the person is conscious, should you ask before helping?
Yes, absolutely. If the victim is conscious and seems able to understand and respond, you should always ask for their permission, their consent, before providing aid. Can I help you? Or is it okay if I try to help? That respects their right to decide what happens to them.
But what if they're unconscious? Like in cardiac arrest, you can't exactly ask them.
Right. In situations where the person is unconscious, unresponsive, or otherwise unable to give consent due to the emergency, the law generally operates under the principle of implied consent.
Implied consent.
Yes. The law essentially presumes that any reasonable person in that dire situation would want help, especially life-saving help. So consent is implied, allowing you to act immediately without needing explicit permission. This removes a potential hesitation point in critical moments.
It really seems like the legal system tries hard to remove barriers to helping. You even mentioned specific federal laws for situations like being on an airplane.
That's right. The Aviation Medical Assistance Act of 1998 is a great example. It provides specific legal protections for healthcare professionals, doctors, nurses, EMTs, who volunteer to provide medical assistance during an in-flight emergency on a U.S. airline.
Why was that needed specifically?
Because doctors and nurses were understandably worried about the legal risks of practicing medicine outside their usual controlled environment, without their normal equipment or support staff, potentially across state lines. This federal law was passed to explicitly address those concerns and encourage them to help when emergencies happen at 30,000 feet. The very fact that Congress felt the need to pass such a law highlights how significant the liability concern can be and how important it is to remove that barrier so trained people feel comfortable stepping up.
So the takeaway here is that the legal framework, from state Good Samaritan laws to specific federal acts, is really designed to support and protect people who act in good faith to help someone in a medical emergency.
Exactly. It should provide a strong measure of assurance. The system wants you to help, and it offers protection when you do so reasonably and responsibly.
Okay, we've spent a lot of time building that crucial emergency action plan, what to do in the moment. But ideally, We want to avoid ever needing to use it. We have to talk about prevention.
Absolutely. Because the reality is, as we mentioned, heart disease is still the #1 killer for most groups in the United States. That makes prevention not just important, but really non-negotiable for long-term health.
And prevention really starts with knowing your risks and managing them medically, right? Working with your doctor.
Precisely. Regular checkups and screenings are fundamental. They help identify and, more importantly, control the conditions that significantly increase your risk of a heart attack.
What are the big ones we need to watch?
The 3 major culprits you absolutely need to keep under control are high blood pressure, hypertension, high cholesterol, and high blood sugar, especially if it progresses to type 2 diabetes. When these conditions aren't managed properly, they directly contribute to that plaque buildup, the atherosclerosis, in your arteries that we talked about earlier. Getting those numbers under control through lifestyle changes and, if necessary, medication is probably the single most effective medical strategy for preventing a heart attack.
So know your numbers, blood pressure, cholesterol, blood sugar, and have a plan with your doctor to manage them. What if someone already has symptoms that worry them, or a family history?
Yeah, in those cases, more proactive monitoring might be needed. If you're having occasional chest pain, shortness of breath, palpitations, or other concerning symptoms, your doctor needs to know. They might recommend specific tests to investigate further, things like stress tests, or maybe wearing a Holter monitor that's a portable device that records your heart's electrical activity for 24 or 48 hours, can help detect underlying blockages or irregular heart rhythms before they cause a major event. Early detection is key.
Okay, so medical management is crucial. But then there's the huge part we control every day, our lifestyle choices. The American Heart Association often talks about the life's essential 8, right?
That's right. It's a great framework covering the key lifestyle factors for heart health. We should definitely break those down. Let's start with probably the most impactful one you can change.
Smoking.
Absolutely. Do not smoke or use tobacco products in any form. Cigarettes, cigars, vaping, chewing tobacco, all of it. It's the single biggest preventable risk factor for heart disease. Tobacco smoke directly damages the lining of your blood vessels, making plaque buildup much more likely.
And the benefits of quitting are pretty immediate, aren't they?
Amazingly so. If you quit smoking, your risk of coronary heart disease drops by about 50% after just 1 year. 1 year. That's a massive reduction and shows just how quickly your body starts to heal once you remove that poison.
Wow. Okay, number 1, ditch the tobacco. What's next on the list?
Get regular physical activity. Move your body. The current guidelines recommend adults get at least 150 minutes per week of moderate intensity aerobic activity.
What counts as moderate intensity?
Think brisk walking, cycling on level ground, gardening, dancing, things that get your heart rate up, but you could still probably talk. Or you could do 75 minutes a week of vigorous intensity activity, things like jogging, swimming laps, hiking uphill.
So cardio is important. Anything else?
Yes. Don't forget muscle strengthening. The guidelines also recommend doing muscle strengthening activities like lifting weights or using resistance bands at least 2 days per week. Exercise isn't just about burning calories. It literally strengthens your heart muscle, improves circulation, and helps manage blood pressure and blood sugar.
Okay, exercise regularly. Next up, inevitably, is diet and weight.
Right, they go hand in hand. Maintaining a healthy weight is crucial because excess weight, especially around the belly, puts extra strain on your heart and is linked to high blood pressure, high cholesterol, and diabetes.
And the diet part. What should we focus on eating and what should we limit?
Focus on eating a pattern rich in nutritious foods. That means lots of fruits and vegetables, lean proteins like fish, poultry, beans, whole grains instead of refined ones, low-fat dairy products, and healthy fats from sources like nuts, seeds, and olive oil. At the same time, you really want to limit your intake of processed foods, especially those high in added sugars, unhealthy saturated and trans fats, and sodium salt. Also, limit sugary drinks and be mindful of alcohol consumption. These dietary changes directly impact your cholesterol, blood pressure, and blood sugar levels.
It's about the overall pattern, not just banning one food.
Exactly, a heart-healthy eating pattern.
Okay, we've covered tobacco, exercise, weight, and diet. What else is in the essential 8? There are 2 more often overlooked ones.
Yes, managing stress and getting enough quality sleep. These are really important and increasingly recognized for their impact on heart health.
How does stress affect the heart?
Chronic stress, the kind that goes on day after day, keeps your body in a prolonged state of alert. It elevates stress hormones like cortisol, which over time can increase blood pressure, cholesterol levels, and inflammation, all of which damage your blood vessels. Finding healthy ways to manage stress, whether it's through exercise, mindfulness, meditation, hobbies, or social connection, is vital.
And sleep. Why is that so critical?
Sleep is when your body repairs and restores itself. Not getting enough quality sleep, the recommendation is generally 7 to 9 hours per night for adults, disrupts all sorts of bodily processes. It can negatively affect blood pressure regulation, heart rhythm, metabolism, and increase inflammation. Consistent lack of sleep is a definite risk factor for heart problems. So, prioritizing sleep is prioritizing heart health.
So it's really a holistic approach, managing medical risks and making conscious choices across all these lifestyle areas.
It really is. Prevention isn't a one-time fix. It's an ongoing, intentional effort across all 8 of these interconnected factors.
This has been incredibly informative, a really vital deep dive. If we had to boil everything down, condense all this crucial information into that core sequence, the absolute must-do steps in a heart attack emergency, what are they? Let's make it crystal clear for everyone listening.
Okay, let's repeat that sequence one more time just to really cement it with that calm confidence we talked about. 4 key steps. First, recognize the signs. Pay attention to chest discomfort, yes, but also be highly aware of those less obvious symptoms. The unusual fatigue, shortness of breath, nausea, pain radiating to the arms, jaw, back, especially if they feel off or unexplained. Don't dismiss subtle signs. Trust your body.
Okay, step 1, recognize. What's step 2?
Step 2, immediately call 911 or your local emergency number. Do not hesitate. Do not try to drive. Activate the emergency medical system right away. Time is critical. That's the absolute priority.
Step 3, while you're waiting for help.
Step 3, while waiting for EMS, have the person stop all activity and rest. Help them into a comfortable seated, upright position, ideally with their back supported. Loosen any tight clothing around the neck or waist, and try to keep them and yourself as calm as possible.
And the potential 4th step, medication.
Step 4, if the person is conscious, able to follow commands, can chew and swallow safely, and has no known allergy to aspirin or major active bleeding issues, assist them to chew 1 regular strength, 325 milligram aspirin, or 2 to 4 low-dose, 81 milligram aspirin. Make sure it's not enteric-coated. Chewing it gets it working faster to help limit clot growth and heart damage.
Recognize, call 911, sit up and rest, chew aspirin if safe. That's the core sequence.
That's the core sequence. Your ability to stay calm enough to remember and follow those steps is what bridges that critical gap between the start of symptoms and the arrival of paramedics. That preparedness can genuinely make the difference, measured in heart muscle saved and ultimately in survival.
It really underscores the power of knowledge in an emergency. And maybe this deep dive leaves you with one final thought to consider. Knowing these immediate steps is incredibly powerful. But think about taking the next step. Learning CPR and how to use an AED isn't just for medical professionals. It's a skill that empowers you to potentially save the life of a family member, a friend, a colleague, or even a stranger in your community. Consider looking into a local course. It's an investment in safety.
Absolutely. Stay safe, everyone. Stay informed, stay prepared, and keep diving deep into the knowledge that matters.